experiencing hair loss of grade 5, reaching grade 6 like this video is meant for you. You can still achieve hair growth like this. There is still hope. And this hair growth is just in 6.5 months. So there is still better density to come for him and you as well. In next 3 minutes, I will show you the hair growth journey of a patient who was grade 5 reaching 6 in just 6.5 months. We will also tell you how AI can help you see your result even before you undergo hair transplant surgery. So please watch this video till the end. So he tried everything before coming to us: social media advice, online advice, different types of serums, shampoos, hair oils, but nothing actually worked. And without a visible reversal of hair, keeping on losing hair, receding hairline, hair going from front top up to the ground gets frustrating sometimes for everyone. This receding hairline and hair loss in between 20 to 40 years of age sometimes can rattle you very much. Your confidence, your self-image can become low. Hi, my name is Dr. Preeti Saraswat. I'm an American board certified hair transplant surgeon. We at Saraswat Hospital are seeing hair loss patients for past more than a decade and a half. And after seeing more than 1,000 patients for hair loss, I'm here to educate you how we can help a patient like this. Do subscribe this channel for many such testimonial and educational videos. When you come to us for consultation, what really matters is a long-term treatment planning. Your hair loss is not for a day or for 1 year, and this single hair transplant surgery is not the end to everything. We are here with you for your hair growth journey. Hair transplant is a part of it. For the rest of the life, when you're losing more hair or there is something else to be done, we are here for you. So the first thing to be done is trichoscopy. What is trichoscopy? It's a computerized examination of your hair and scalp, which tells us the condition of existing hairs at the donor area, in the recipient site, what is the density of hair, how many grafts we can take out, how many you actually have, what is the calculation of recipient area, how many grafts are to be put there, then according to our skill and experience, what is the density we want to give you in order to achieve a good result artistically. So planning matters more than rushing to a hair transplant surgery at once. For him, we deduced that around 4,470 grafts would be required for him. If you are suffering from hair loss and you can see your hairline is going back, it's receding, do tell us in the comment section below that why you are delaying your hair loss treatment. As you can see his trichoscopy report on your screen, his donor area was good. It was appropriate for the number of grafts to be taken by FUE method, because we decided to go with follicular unit excision method by a very good machine which shows the number of grafts taken. So the counting of the grafts taken is seen every time we punch a graft. So his average thickness of donor hair was 0.08 millimeters, which is good enough. Average donor area density was 83 grafts per centimeter square. Again, it's good enough. Coverage value was 13.59, which is good. It's from 5 to 15, so it's on the upper side. And hairs per follicular units were 2.1, which is again average. So in short, we could take the required number of grafts comfortably. So you see, planning, precision and safety of the patient is of utmost value here, which we honor at Saraswat Hospital. Please press the like button if you find this information valuable. You can now see pictures of this patient on the day of surgery, 4 days after surgery. See how nicely the donor area is being healed. This picture is after 5 months, and now you can see his picture after 6.5 months only, and see how nice the growth is, how nicely the donor area has been covered without any evidence that there was any graft taken from there. So the growth of the hair is progressive. It's not linear. We can appreciate the blending and naturalness of hair. Even before undergoing surgery, if you want to find out how you would look after surgery, you can take help of PeekAI feature of Saraswat Hospital app in very simple steps. Just download the app, click on the PeekAI feature, then you can upload your picture from the front and top. In next 24 to 48 hours, you'll receive back your pictures with probable results, and these results would be seen by ABHRS doctors. Also, we will will tell you the approximate number of grafts which would be required by you, and so that you understand your hair transplant better, we'll give you a set of questions which you can ask your doctor so that you also have a say in your transplant surgery. If you want a hair transplant consultation with us, you can call us on the number below or you can WhatsApp us your pictures. Understanding that you are having a problem of androgenetic alopecia or male pattern hair loss is your first win. When you understand this, you can very well go to a well qualified hair doctor and informed evaluation with trichoscopy, with dermoscopy. Then long-term treatment and planning is much more important than self-treatment or self-diagnosis. Do not forget to share this video with your family and friends who are undergoing hair loss problem and who want a treatment for it. If you want to identify your hair loss stages, you can click the video on the left, and if you want to know the cost of hair transplant, you can click the video on the right.